Can you hear me clearly? Can you hear me now? Network was disturbing. If you can hear me, oh, that's nice. Nice that you're joining my live. So I'm talking about what it means to be HIV. You can hear me clearly, right? Thank you so much. Thank you for letting me know. Last time I came live, network was disturbing, so sometimes when I talk, someone can't hear me clearly. So I'm talking about what it actually means to be HIV undetectable. You understand? So we all know that HIV is human immunodeficiency virus, a virus that attacks your immune system. So when HIV enters into your body system, it attacks your white blood cells. Specifically, it targets your CD4 cells, which is your T helper cells. Your CD4 cells is the immune cells that helps to fight off infection. So when it enters your body, this virus attaches to these cells, and when it enters into these cells, these CD4 cells, it starts to attack it and multiplies. So if maybe the person that contacted, you don't start taking treatment on time, if you are not aware that you have HIV and you don't start your treatment on time, because of the multiplication of this virus, it increases your load. It increases your viral load, and when your viral load is increased, if medication, you don't take your medication for maybe months or years, it can progress to AIDS. So that is what I'm talking about being undetectable today on our live stream now. What it means to be undetectable. You understand? Being undetectable means that the virus, the virus is below 50 or 50 to 20 copies per millimeter in your blood. Is below that 50 to 20 copies. That's the HIV RNA. Is below 50 to 20 copies per millimeter of blood. Per millimeter of blood. So being undetectable means that you can't easily transmit this virus, right? Because they have this slogan is undetectable equals untransmittable. But that does not mean that you should start because you are undetectable, you should start what they call it, giving out blood, transmitting blood transfusion. This undetectable of 18 specifically apply to sexual transmission. Don't worry, I will explain why it's like that. This undetectable, HIV undetectable, in the sense that after you take your drugs, you are consistent with your drugs. Because after you are diagnosed with HIV, doctor will run a different test to know your viral load. This test measures the amount of HIV in your blood. So the viral load test that doctors run you after you are diagnosed with HIV measures the amount of virus in your blood. I mean the amount of this HIV in your blood. So for you to be undetectable, you should have at least 20 to 50 to 20 copies of this HIV RNA per millimeter of blood. So this untransmittable equals to undetectable equals to untransmittable applies majorly to sexual transmission. The reason why it's like that is because being undetectable does not automatically mean that you are cured of this virus. Does not mean that HIV is not there. HIV is there, but just that the viral load is suppressed. Suppressed in the sense that the virus cannot cause harm. So you cannot cause some symptoms, cannot even cause harm to your immune cells. is suppressed because when you take your medication, your retroviral medication, it helps to suppress this virus, particularly if you're consistent with it. Not like you take today and you leave tomorrow. If you're consistent with this virus, some persons can take them 6 months to be undetectable. Some persons can take them 12 months after diagnosis to become undetectable. Why some less than a month? Some even 3 months to be undetectable. So when you are undetectable, it means that you can't easily transfer this virus sexually. I've seen couples that where one partner is HIV positive while the other is HIV negative. They went about having kids and that same partner still remains HIV negative. The truth is that the other partner that is HIV positive stick to this, is consistent with the drugs and remains undetectable. Because for you to remain undetectable, you have to take your drugs every day. You don't have to skip it. You don't have to compromise your medication. Because anytime you stop that drugs, whether a few days, the virus will start multiplying, begin to reproduce. Because that drugs helps to stop those the life cycle, some of the life cycle of this HIV. If you are joining my life, you're welcome. Do wait to subscribe. So this retroviral drugs helps to stop the life cycle of this HIV so that they can reproduce. Because the more they reproduce, the more they attack your immune cells, particularly your CD4 cells. So your CD4 cells is their main target. That is why before some progresses to AIDS, you know that your immune system is either severely damaged or totally damaged. Before they diagnose you of AIDS, your CD4 counts or your CD4 cells should be at least I think less than 200 um cupid per millimeter. So being undetectable does not mean that you should automatically start sharing needle. Maybe you are undetectable and you have children at home or you have people at home and you start sharing needles, sharp objects just because of your HIV undetectable. You are risking, there's a possibility that you can also transfer that virus to them, even if you're undetectable, even if the rates at which you can transmit it is more lesser than when you have a high viral load. There's still possibility that you can transmit it via blood transfusion. So that is why in the hospitals they don't allow patients, people that are HIV positive to transmit blood. The reason why it's like that is that HIV can hide in some certain kind of cells in the body, some certain kind of tissues in the body. This virus can hide there that your immune system, your immune cells can't easily detect them, can't easily detect this HIV, and your drugs, those medications, can't actually detect them easily. So, sorry, if you're joining my, I can ask, you can drop any question in the comment below. So that is why blood transfusion, if you're undetectable, does not automatically mean that there's no HIV virus in the blood. There is, but it's just that the viral load is suppressed. You understand? It's suppressed. So if maybe your mother or maybe your partner or your partner is undetected, we don't automatically start sharing needles. Don't automatically start sharing sharp objects because you can. There's a possibility that you can still transmit it through that means. So being undetectable specifically apply to sexual transmission because a study was conducted where scientists studied thousands of couples for years, where one partner is HIV positive while the other partner is not HIV positive. So they studied these couples for years. The one that is HIV positive are undetectable, are consistently, emphasis on being consistently undetectable, and emphasis on being consistently taking your medication, because anytime you default on taking your medication, your viral load increases. This virus starts multiplying. What is this just only helps to stop the life cycle of this virus so that they can't reproduce. So this research study was conducted where thousands the researchers monitored thousands of couples where one was HIV positive while the other wasn't HIV positive. And the couples that were HIV positive were asked to be taking drugs. So over the years, they find out that there was zero transmission of the virus. There was zero transmission of the virus. That means the one that is negative did not get it. It wasn't transferred. The reason why it's like that because one, the other couple is consistent with their drugs. So if you're undetectable, you can still live your normal life. You can still get married, have your kids. Someone is asking, can someone marry a person that is HIV positive? Yes, of course. Why not? Ah, we are in modern medicine now. Modern medicine has made things more easy. Unlike decades ago, where HIV diagnosis is just as if it's a death sentence. In fact, there was this story I heard online. Let me share the story here. There was this story I heard online where a lady was HIV positive. So because of the stigma, she never wanted to tell her husband that she has, I mean the man that wanted to marry her, that she has HIV. The man is negative, you understand? So she understand how this virus works. One thing about some of the things people experience today, just lack of knowledge, lack of negligence. You don't have the right knowledge. But meanwhile, this is not 100%, So she understood how this HIV stuff works. She went ahead and got married, and they did not did anything like blood tests. She went ahead and got married. She was consistent with her drugs, and she was undetectable for years. Undetectable for years. She ended up having kids. So she was sharing her story online, and she felt guilty because her husband did not know her status. Meanwhile, the husband is negative. So she finally opened up and told the husband. So the husband went to run a test, run for the kids, and all of them are negative. So I'm answering that question that is here. Can someone marry a person that is HIV positive? So I'm using this story now to illustrate what I'm trying to explain to you. No, just hold on. Don't just say Let me explain first. So the lady, in the process of telling the husband was actually devastated because your status is not something you hide from your partner. I don't support that. Even if you don't tell your family member about your health status, like your HIV status, your partner that both of you are intimate with. I'm not talking about your boyfriend. Your boyfriend, of course, you owe that one, but your husband and wife, you should tell them. You should tell them your status, your partner, whether your boyfriend or your girlfriend, they should know your status. So later on, she opened up because of the stigma, some marriages. Once you tell your partner that you are HIV positive, they will start thinking as if they are doing you a favor by staying in that relationship. I'm fine. I can see you. Hi, I'm fine. So they will start thinking that they are doing you a favor by staying in that relationship or marriage. So this was what happened to the lady. Later, she opened up to the man, to the husband, and they went for tests. And it happens that he's still negative. The kids are negative. The reason why it's like that because the lady was undetectable and she knew how this thing works. She was taking her medication, never defaulted, not the one you take to this week and you just skip some days. That's how some people take. In fact, some person, when you give them malaria drugs to take, they will just take two times. Maybe they'll take just 2 days. Once they get themselves, they throw the drugs away. They are not consistent, even taking malaria drugs of 3 days. Talk more of a drugs that you take a lifetime. So some of them, they just take it when they feel like, or they even take it when they start having some kind of infection or maybe some kind of symptoms. So if you're that kind of person, just know that you can easily spread this virus. So that lady in her marriage, it caused an issue because when the man find out that she lied about her status, that she was HIV all these years, it caused an issue to her because both of them start having issues. I don't want to go deep in such kind of story. But yes, you can marry someone that is HIV positive, provided that you take your medication, provided that you are undetectable. See, she said your boyfriend, of course, hold that one. I don't understand you. She said your boyfriend, of course, hold that. I don't understand. So you can marry someone that is HIV positive. We have our technology, medicine has advanced. You understand? It has advanced. Being HIV positive does not automatically mean that you are less of a human being. So don't see yourself that way. You are less of a human. Don't allow those stigma to get into your head. Tell us, we are they happy? To be honest, she was the lady was trying to um seek for advice because the marriage was so hectic that the man was even going outside to cheat on her. So she was even scared that if this man contacts this virus outside, it will be as if she's the one that infected him. Meanwhile, all these years, he has not gotten the virus. So the man was a chronic humanizer. So she was so devastating. That kind of marriage that someone is that you are doing them good because of your status. And when you open up to family member, because she was narrating that when she opened up to family member, they would tell her that it's her fault because she lied about her status. You understand? That she should just manage, that the man is just doing her good. Like which man that will still continue such kind of marriage when you hide your statue, your HIV statue? You understand? So I was just trying to use this story to explain a question that someone asked here. They have not separated yet. Did they separate? They have not separated yet, but she's still trying to figure out if she will continue the marriage or if she will not continue the marriage. Kids are involved. Marriage is not something you just walk in today. No, I'm a clinical physiologist. I'm not a nurse. I'm not a doctor. So marriage is not something that you just walk in today and go out tomorrow. You understand? You consider some factors also before you leave. So being undetectable does not mean that, okay, thank you so much. Does not mean that there's no possibility that you cannot transmit this virus. So some person think that once you are undetected, we can go to the hospital and donate your blood. It doesn't work that way, please. Say marriage can be done today and done tomorrow. Marriage can be done today and done tomorrow. I don't get it. Is it that marriage can be done today and divorce tomorrow? Is it what you meant? It's not that easy now to just, marriage is not relationship. There's this quote they say that a breakup of 1,000 relationship. Okay, a relationship, 1,000 relationship that breaks is better. Would I say is better than a one marriage that breaks. So marriage is not something you just enter today and leave tomorrow. So back to my story about back to HIV. See, before something progresses to AIDS, before something progresses to AIDS, for those of you that don't like going for screening tests, you have some kind of fever. You keep on treating keep on treating typhoid and malaria. You go to chemist, you go to pharmacy. What stops you from going to the hospital to run some kind of tests? So if you allow your HIV to progress in a way that it damages your immune cells, HIV is not actually the issue here. The issue here is AIDS. So HIV is not where the issue lies. Of course, it has its own issues, you understand, because having a virus that attacks your immune system and you constantly taking drugs. HIV is not a death sentence. Where the issue lies from it progressing to AIDS, allowing this virus to attack your CD4 cells, to attack your immune cells, to attack your CD4 cells to a point that it starts to count below 200, because a healthy adult is supposed to have from 500 to 1,005 CD4 cells. For them to diagnose you of AIDS, that means you have less than 200. What food can my woman cook for me to prevent stress? What sort of question is that? Just tell her to prepare any of your favorite foods, okay? Tell your woman to prepare any of your favorite food. What's your favorite food? Drop it in the comment section. So, if you allow these immune cells to, I mean, this HIV to attack your immune cells to the point that your CD4 cells gets below 200, then it is where it is diagnosed as, and it is a life-threatening condition in the sense that once this virus progresses to AIDS, it's very, very difficult to reverse. People don't die of HIV, people die of AIDS. They don't die of HIV, they die of AIDS. So, favorite food care. You don't have a favorite food. I've not seen anyone that doesn't have a favorite food. That's not true. So people don't die of HIV. What they die is of AIDS. Because at that point, your immune system is so weak that any opportunist infection can just harm you. Certain kind of cancer that your immune system ordinary could have fight off, at that point is so weak to fight it. So when this virus progresses to AIDS, sometimes it's not even the AIDS that is killing you, it's just opportunist infections, some kind of infection that even ordinary flutes, co, can even cause death because one, your immune system is so weak. Any bacteria at all can just enter. Do you know how many bacteria and viruses that our immune system are fighting every day? The food we eat? No, I said no. You don't have any favorite food. Are you a Nigerian? Is this your uniform? Yeah. Are you a Nigerian? Why don't you have a favorite food? I've not seen someone that is from Nigeria, like you in Nigeria, you don't have a favorite food. With all the assorted food we have, afan soup, vegetable soup, okusi soup, and you don't have any favorite food. You say favorite food. You have. Okay. You say you don't have any, okay. Okay, you can tell your woman to cook afan soup for you if you don't have any favorite food. So back to what I'm saying about being undetectable. So for you to be undetectable does not mean that you can't transmit this virus. So you should be cautioned if you are the type that share needle. I don't get you. Write it again so I understand. If you are the type of person that you share needle, not being undetectable reduces your risk of transmitting this virus, but through blood transfusion, no. No, do you prescribe drugs? Well, no, 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 no. They don't prescribe drugs. So I don't prescribe. Why would I prescribe drugs? So being undetectable does not automatically mean that the virus is out of your body, that you are cured of. Currently, there's no known cure. Sorry to answer your question. Let me put something clear. Only a doctor that is licensed to prescribe drugs, not even a nurse, not even this thing, a physiologist. So only a doctor that is. Do you suggest drugs? If you have any issue that would need drugs, you should go to the hospital and see a doctor. So that is not our ethics here as a medical personnel. We don't prescribe drugs apart from a doctor. Before you prescribe drugs, doctor should check you to know what is wrong with you. Don't just guess. You understand? If it's something that you need to run some screening tests, you do some tests to know what actually is wrong with you. So you don't come online and someone start prescribing drugs to you. It's not done. It's not good, okay? So if you have any health challenges, go to the hospital. I give you an assignment to do that. I give you an assignment to go and Google it out. So being undetectable does not mean that you can't transmit this virus because HIV hide in some tissue cells, some cells in the body that even immune cells cannot, attack them there. The medication cannot attack them there. So when you take this medication, this HIV drugs, it helps to reduce the way this virus multiplies. And this viral load test is not something you do once, something you go for, they go months to check. So you can't just, maybe you did a viral load test maybe last 2 years or maybe 1 year ago, and automatically you are undetectable since how many years ago till now, without you going again to check. And if you are the type that is not consistent with your drugs, maybe you take today and leave tomorrow, this virus can still multiply. And when it start multiplying, your viral loads are high, and you know what it means. It start attacking your immune cells. So that immune cells start attacking is where the issue lies, because if it progresses to AIDS and it attacks your CD4 cells, that's your T helper cells. And if your T helper cells is below 200, then you know that that's AIDS. HIV is not actually a death sentence. Where the issue lies majorly is AIDS. People don't die of HIV, it's AIDS. Because when it progresses to AIDS, your immune system is down. Any infection at all can easily invade your body. Sometimes self, it's not even the AIDS that is killing you, just minor infection that ordinary your immune system should could have fought off. Some certain kind of cancer that your immune system could have fought off, because of your immune system is low, this type of infection invades you and just, that's why you see someone that has is very, very lean, they can't walk. It's as if it's life and death issue. So if you have HIV, don't see it as a death sentence. Medicine has modernized. Not like the case ago where once you mention HIV, everybody starts, scared. Is you die. It's not like that. Someone that has HIV have almost the same life expectancy with someone that is not HIV positive. Honestly. So you being HIV does not mean that is your life is gone, or maybe you have lesser lifespan. No, you almost have the same life expectancy with someone that is not HIV positive. So being undetectable, it can means they say you equal to you. That's undetectable equals to untransmittable. That specifically apply sexual transmission. So try to avoid anything that has to do with blood transmission, particularly if you're undetectable. There's still possibility that this virus can still pass through. You understand? That's why they don't allow patients, people that are HIV positive, to donate blood in the hospital, because it has its own risk. Undetectable does not mean that the virus is completely gone. There's some copies there, but just that when they run you tests for viral load, sometimes it might not even detect anything. There's a way that you be undetectable, like you take your drugs consistently and it's not something that you omit. You go for some laboratory tests that they won't even detect that you have HIV. I'm honest, I'm being honest here. They won't even detect the HIV in your blood. That is how serious it is. So when you're consistent with your drugs, it's as if you're living your normal life. You understand? But just that this you have to continue taking your drugs. If you have any question, you can drop it in the comment below. So being undetectable equals to untransmittable. You can you can sorry, my phone is malfunctioning. Someone that is HIV positive can actually get married to someone that is HIV negative. Hello, you may find this interesting and educated. Hi, I can see you. I can see your comments. Thank you so much. Thank you so much. If you are joining my live, too wait to subscribe. Don't just go with that subscribing. So you can drop any question if you want. So being undetectable does not mean that you can't transmit this virus, but just that the possibility of you transmitting the virus is low, is low compared to when your viral load is very, very high. You understand? If you go to some marriages right now, you see that one partner is HIV positive while the other is HIV negative. So it happens. It's not everybody that will start to tell you their status. They don't owe you that. Nobody owes you to start telling you their whether they are HIV positive or not. No. So I've seen couple like the story I told earlier where a woman got married. I told a story here for you, for those of you that are joining my life just now. I told a story here that there was this lady that she was very aware of her status that she has HIV, but because of out of fear of stigma, she doesn't want all the stigma of a thing. So her fiance then that she she did not tell her, and they did not go for this blood test. So eventually they got married. She had she later have kids, after so many years. After so many years, so she decided to open up because she was feeling guilty that she has this kind of thing, and her partner, which is her husband, is not aware. So she told her husband, and you know what? Hmm. They later went for tests. The man, the kids, they went for tests. They ran the necessary tests, and it happens that the man is not okay. Bye. Thank you so much. I really appreciate Wizzy. Thank you. So it happens that the man is negative. The kids are also negative. The children are also negative. You understand? So the what happened is that when the husband find out and they went for test and the husband is still negative, the children are negative, it brought a lot of tension because he was really shocked that I could keep such a secret for years. She never mentioned it to him. You understand? Although the woman understands how this virus work. So she was kind of asking question because she understood how this virus work. She was undetectable and she remained undetectable by taking her medication. So in that means of taking her medication, she couldn't transfer it to the husband. Hope you know that you can have HIV as a woman and you become pregnant and your kids will not have the HIV. So that is how medicine has advanced. Modern medicine have advanced. So her kids, all of her kids were negative. Her husband also was negative. But just that the marriage was shaking because it was built on lie. You understand? It was built on lie. And the man started making her feel as if he's doing her favor. He's doing her favor by marrying her or staying in the marriage just because of she's HIV positive. So that is an issue when it comes to our society today. Some person thinks that if you are HIV positive, they are doing you a favor by getting married to you. It doesn't make you less of a person if you're HIV positive. It doesn't make you less of a human being. You understand? Because HIV is just like other kind of chronic condition. Is manageable. It's manageable. Just like diabetes is a manageable condition. It doesn't have cure. You understand? Doesn't have cure. Just that you can control it, you can manage it. So if you detect that you have HIV early and you start taking your medications, within 6 months you can become undetectable. Some persons can take them a year to become undetectable, while for others it can take them a month, even some 3 months to become undetectable. When you're undetectable, you can't easily transmit this virus. So the virus does not only protect you, it also protects your partner, people around you, because that viral load is not high. Because if the viral load is high, you can easily transmit it. And one thing again you should take note of, you being undetectable does not mean that you should start donating blood, or because it can still there's possibility that this virus can still be transferred through that means. You understand? Can still be transferred through that means, because being undetectable, the virus is still there, but just that it is extremely low, that even some laboratory tests cannot detect that you have HIV. So someone that is undetectable, that is consistently taking their medication, can still go and run HIV test with you. Maybe your partner say, let's go and not accept you. And the lab still say they are negative. I've seen such kind of things happens. someone that is HIV positive can still go and run it, the same test that you are going to run, and the test result will say that they are negative. The reason why it's like that because their viral load is very, very, very low, below less than 50 to 20 copies of HIV. Is it per millimeter? HIV RNA per millimeter. So when it's less than like that, some laboratory tests cannot even detect it. And when you go for some viral load tests, it can't even. So that's why sometimes they even test negative. So nobody owns you this thing. It's left for you to protect yourself. You understand? If you're a negative person, don't just go around and start having unprotected sex with your partner. Someone that you don't trust, someone you don't know, just no, it's not good. So before you have any sexual activity with someone that you don't trust, make sure that you run a proper screening test to know their health status, because HIV is not written on the face. It's not written on the face. That's just the honest truth. It's not written on the face. When you're undetectable, these these drugs help to suppress the virus in a way that it won't even cause like some of the symptoms. You won't even see it. The immune system it causes it that it suppresses it in a way that it won't cause symptoms. So you can't measure someone that has HIV by their look, or maybe I start measuring this one is slim, this one is have rashes. Although some symptoms are some persons own are like that for those that don't take their drugs consistently. But for those that take their drugs consistently, sometimes you not even know. You not even know, honestly. You not know. You not know. Sorry, let me check. So for those that takes their drugs consistently, it's not even written on the face. It's not written on the face. So you owe yourself that duty of protecting your health, protecting yourself. Nobody owes you anything by start telling you their status. Some persons they can go down with you without even you knowing that they are HIV positive. So it's left for you to go and do screening test for them. Both of you, before you go down, there's HIV test script that you can just do at home. Within few minutes, the result will come out. You know if your partner has it or not. Not just you start going down and don't even know their hair status. It's kind of risky. I wonder how people have the mind to do such kind of thing. You don't know the hair status of someone and you just want to go down with them. I So it's not something you do, please. So knowing your status is very important because the earlier you detect this virus, the better. The better. HIV does not kill. Now AIDS where they kill, no be HIV. AIDS is the one that kills, not HIV. So the earlier you detect it, the better, because when you start taking your medication on time, this virus will not have time to destroy your immune cells. Remember, when it enters your body, it attaches to your CD4 cells, and when it attaches to your CD4 cell, it enters these cells and start to multiply. When it start multiplying, it destroys these CD4 cells, which is your T helper cells. And your T helper cells are your white blood cells that helps to fight infections. So if your CD4 cells is low, very low, below 200, then you know that you are between life and death, because that below 200, your immune system is very, very weak. And since your immune system is weak, opportunist infection can easily slide into your body, even something that is not supposed to kill you. Some certain kind of cancer that is not even supposed to cause harm, that your immune system ordinarily could have fought off, just because of your CD4 cells is less than 200. You see this kind of infection having hold on that person. So sometimes they don't even die of AIDS, they die of all this opportunist infection. Ordinary flu can kill the person because the immune system is down. We are exposed to different kinds of viruses, different kinds of bacteria, yeast, the kind of food we even eat. Imagine if maybe those food that you are eating, there is no immune cells to get rid of some certain kind of bacteria. It will go there and cause harm. So if your immune system is weak, it opens you to different kinds of infection. That is why if you allow your HIV to progress to AIDS and your CD4 cells is below 200, because if it's below 200, it's where they diagnose you of AIDS. So having a high viral load, you having a high viral load does not automatically mean that you have AIDS. Having a high viral load does not automatically mean that you have AIDS. AIDS is mainly diagnosed when your CD4 cell count is below 200, because a normal healthy adult is supposed to have a CD4 cell count of 500 to 1005. So anything below, in fact, anything from 500 down shows a weakened immune system, a very, very weakened immune system. Then if it is below 200, then it is AIDS. I know that AIDS is not easily reversed. It's not something that you can easily reverse. In some cases, once you are diagnosed of AIDS, it's not something that you can have. Although I've seen people that are diagnosed of AIDS that later they start taking drugs and they come out, they get themselves back again, their body back again. But once you are diagnosed of AIDS, it's not something that you can easily reverse. So it is good that you start taking medication early, know your status early. Start taking drugs when you are meant to take your medication. Don't skip it. So it's something you take continually, not something you take now and leave tomorrow. If you have any question, you can drop it in the comment section. Let me go through this my WhatsApp to get some things. Sorry. So nobody owes you any responsibility of telling you their status. No. In fact, some persons will even decide to keep their HIV status to themselves. Reason because of discrimination, stigma, fear. You understand. Some persons that have HIV is not actually the virus that is killing them. It's because of the fear, the stigma. Your neighbor this knows, your auntie this knows, and if you pass, they are giving you some kind of sign language or this. All those kind of things can be stigmatizing. So some persons even decide to just keep it to themselves. So you that is not negative, it is your responsibility, not someone else, to take good care of your health before you go down with someone that you are not too sure of. Make sure you go for a screening test. You can buy this HIV test kits. It's not expensive. It's not something that you should risk your life. You understand? It's not expensive. It's not something that you should risk your life. You can keep it at home. You can just run the test easily at home and know if your partner has it or not. And you yourself go for regular monthly checkup also. So if I should ask now, what's your biggest fear about HIV? Is it because of it's not curable? Is it because of um a stigma? You understand? So when it comes to HIV, what's your biggest fear about HIV? Because we have other deadly disease that um takes life more than HIV, right? We have some certain kind of cancer. People die more of cancer than HIV. So why is it that HIV is more have more stigma than all those kind of things? I think that the reason why it's like that is because of the way people see it. Because this kind of viruses was a death sentence decades ago when medicine has not advanced to the way it is now. When modern medicine have not advanced to the way it is now, you can hardly see someone die of HIV unless maybe they are not taking their medication properly or they do not discover on time that they have this virus. It's just like a kind of chronic condition that is manageable. So I was coming across a live interview where the interviewer asked a doctor is when between HIV and diabetes, which one will you choose? Like between having a HIV, like having HIV and diabetes, which kind of issue will you choose? And I was surprised. He choose HIV. Imagine someone choosing HIV over diabetes. So that should show you that HIV, when you understand it clearly, not like the way we are misinformed before, when modern medicine has not advanced to the way it is now. You can have HIV and really live your normal life, live your normal life, have kids, get married, just live your normal life, provided that you take your medications. Because study has shows that people that have HIV have almost the same life expectancy as people that don't have the virus, have almost the same life expectancy, and they go for monthly checkup. You understand? They go for monthly checkup, unlike some of us that before you go to hospital, might even take you 10 years before you go to hospital and see a doctor. That disease or that infection might have shown you shege. These people, they go for monthly checkup. You understand? They go for monthly checkup, so that gives them more leverage. So if you look at it deeply, if you should think deep about this, it is more of a stigmatization. Because since there is drugs for it, since there is drugs to manage the virus, and it's no longer a death sentence, you can live your normal life, you can get old with the virus, you can have children, and your children will not even be positive, provided that you take the precautions that you ought to take. Your partner, you can still have a partner that is a negative, that doesn't have the virus, and you won't even infect them if you take your medication. If you're undetectable and you take your medication consistently, your partner will not have it also. You can hardly transmit it to them. Not like there's no possibility of transmission, but the rate is very, very slim if you're undetectable consistently and you take your drugs consistently. So what is the issue? Why is it that people do discriminate? Is it that compared to other kind of disease that can end your life within 3 months, some cancer can end your life within 3 months. So I just think more of that is more of a kind of a psychological stuff that people needs to talk themselves out of it. Because some persons, when they hear they have HIV, they start dying inside even before the virus start killing them. So it's more of psychology, you understand? It's more of fear. It's more of what stigma. Not like the virus is killing you. If you are true to your drugs, the virus will not kill you. The virus will only kill you when you don't take your drugs. You allow it to progress to AIDS. HIV does not kill. What kills is AIDS. When you allow your CD4 cell count to fall below 200, and you are diagnosed with AIDS, because when it falls to below 200, it's via ACE. Then you will be diagnosed of ACE, because the normal CD4 cells for healthy adults supposed to be in range of 500 to 1005 to 1005. So if you allow this virus to attack your immune cells, because that's what they do now, human immunodeficiency virus, the major thing they attack is your immune cells, not just any type of your immune cells, your white blood cells, not just any type of your white blood cells, your CD4 cells, your T helper cells. So if you allow this virus to attack and damage your CD4 cells to a point that it is below 200, any form of opportunist infection, any form of opportunist cancer can easily invade your body. Ordinarily, this type of opportunist infection, your immune system are meant to fight it off. You understand? They are meant to fight it off on its own, even without taking any medication, or even without any drugs. Your immune system are meant to fight off this kind of opportunist infection. But because of your immune system is so weakened, is so down, below 200, your CD4 cells is below 200, then that is when you say you are diagnosed of AIDS. So people don't really die of HIV, they die of AIDS when you allow it to progress to AIDS. And why will you allow it to progress to AIDS when there are drugs to take, when there are medications to take that will help to suppress this virus? Because when you take all these medications, some kind of life cycle of this virus, these drugs help to stop them from reproducing. Because once it enters your body, it attaches to these CD4 cells and enters it and start to multiply and start to kill it. When it kills it, when it's completely damaged, is when it diagnoses, it progresses to AIDS. So thinking of it, if you are consistent with your drugs, HIV is not a death sentence. It's not something that you should panic. I think it's more of a psychological kind of issue, because we have other disease that kills faster. Some persons that they will diagnose them of cancer, some cancers that they even have less than 6 months to live. But with HIV, you can live long. You have almost the same life expectancy with someone that doesn't have HIV. And you're on drugs, you're checking your health because you go for monthly checkup, unlike the other one that doesn't have HIV, that just take, before they see a doctor, it might even take decades. So, or you're more of advantage when it comes to regular checkup on your health, taking good care of your health, taking fruits, because some persons that are HIV positive, that's when they start taking care of themselves, honestly. That's when they start watching what they eat, watching the kind of food that will help their immune cells. So your immune cells is not supposed to fall below 500. That's your CD4 cells. It's not supposed to fall below 500. Even if it's 499, you have your immune system is weakened. If it falls below that 500, so if it falls till 200, your CD4 cells, then there is an issue. So that is why early diagnosis, knowing your stage too early, start taking medications. If you are the type that maybe you constantly have fever, you notice that every month you are treating malaria. In fact, you treat malaria every two weeks. You treat typhoid. In fact, any fever you have is malaria and typhoid. Any fever you have is malaria and typhoid. You don't think of any disease, just malaria and typhoid. You treat malaria and typhoid now. Then 2 weeks later, you still take again malaria and typhoid. Every time you are treating malaria and typhoid, go and run test though, so that doctor will know what is wrong with you. Go and run test, because the earlier the better. The earlier you detect this virus, the better. Because that early stage, when the virus has not damaged your immune cells, you start taking this medication, it prevents them from multiplying. It prevents them from multiplying. When they don't multiply much, they don't cause harm, they don't cause much damage to your immune cells. Because this immune cells is what protects us. Without our immune system, we are just like a walking corpse. Because you know the kind of bacteria and viruses we are exposed to every day, like the food we eat, you see some kind of fly perching on them, cockroaches, or all this. You don't even know how they are prepared. So when you eat them, your immune cells are the ones that are helping to fight to keep you alive. So if these soldiers that God created in your body is so weak, you allow it to be so weak, you don't even take anything that will help your immune cells to be strong. You're risking your life. You're risking your life. And for those of you that are negative, just make sure that you are cautious. Nobody owes you anything to tell you their health status. And it's not written on the face. It's not written by big ears. It's not written by having big body. It's not so. Someone can be fresh, have a nice body, and still they are positive. They don't owe you anything to start telling you their status. It is your responsibility to protect your health. It's your responsibility to protect yourself. So why will you go down on someone that you don't know their status? You don't even use protection. You sleep with Nkechi, you sleep with Ada. You don't protect your health. Are you not scared of yours? Like, don't you give a consign? Like, you don't stay and think about yourself. Like, you don't stay and think about yourself because if for anything, if for anything, your health alone should prevent you from being promiscuous. I know that even if you have one partner, that partner might not be faithful, we know, but at least it limits your chances, unlike when you have multiple partners. And before you go down on someone, at least if that person is your partner, you sure that this is my babe, this is my man, this is my woman. Both of you should go for test now. It won't cost you anything. It's not even expensive. They have this HIV test script that you can go to any pharmacy and buy. It's not even expensive. And if you don't, if you are not the type that maybe you are not too sure, you can take prep. There are drugs that will help to prevent it. So when you live your life as if it doesn't matter, it's not good. There are drugs that will help you to prevent this HIV from transmitting. You have prep, you can be on prep. I made a video on prep here on my channel. You can look out for it. Can be on prep. Prep is prophylaxis, pre-exposure prophylaxis. It's something you take daily just to um prevent you from getting this virus, not post-exposure. Post-exposure is when you take it after exposure. You understand? Post-exposure is when you take it after you're exposed to this virus and you take it within 72 hours after exposure, when you maybe are sure that this person has HIV, or maybe through needle prick or maybe any sharp object or through even rape. So you take the drugs within 72 hours. The earlier you take it, the better. Why? For prep. Prep is the medication you take before exposure, before coming in contact with the virus. So it's a drug you take every day. Every day. It's not something you take for pre-exposure. You can take it for, I think, either how many days? 28 days, right? Yes, 28 days. It's taken for 20. It's also some person mistake this, they will just take it one time or two or even three. They think it works that way. It doesn't work that way. You take it for full 28 days. Why? For pre-exposure, before you come in contact with it. It's a drug you take every day. So if you are the type that you are not too sure of your partner and you have multiple sexual partner, the way you live your life, nobody will tell you how to live your life. That's your own decision. I won't tell you how to live your life. That's your own decision to make. So you can buy this prep. It's affordable. If you go to pharmacy, you can get it. If you go to hospital, you can get it. It's not something that is sky, not even that expensive. The way it's not worth your health. You can be taking it, you understand? Maybe you're not sure, just take it. And that your babe, why don't you both go for tests? So nobody owes you anything about their health status. It is your responsibility to protect your health, to protect yourself. You understand? So don't blame someone for your mistake. Don't blame someone maybe tomorrow something happens, they say you are the one that gave it to me, you have to blame yourself first, because it's not your first time of hearing this. So you have to blame yourself. You have to take accountability that you messed up, right? Because there are other means to protect yourself. So why will you expose yourself? We have prep. You can put on condom. Have other means. You can go for tests. You can even buy this HIV kit and keep at home and test yourself. So I'll be ending this live soon, very soon, within few minutes from now, because it's over 1 hour now. So being undetectable equals to being untransmittable. And this specifically applies to sexual transmission. You understand? Because being undetectable does not mean that you should start donating blood. It's not like that. That HIV can still be hiding in the blood, but just that the viral load is so extremely low. Even some laboratory tests will not even detect that you have it. But that does not mean that the virus is not there. It's still there. When you stop taking your drugs, it will come again and start multiplying, start reproducing. So that is why standard medical this thing, they don't allow people that are positive, HIV positive, to donate blood. You understand? Just for safety. They don't allow you to donate blood just for safety. So if you are HIV positive and you are undetectable, and maybe you have children at home and they are negative, don't share needles. I know that you are undetectable. The risk is much lower in transmitting the virus compared to when your viral load is high. But just to be on a safer side, don't expose sharp urges at home. You understand? Just to be on a safer side. If you are going to your salon, just take your things, your personal things, maybe all those nail stuff that they will need to, use on your skin. If you have clipper, have your own personal clipper. This There's a possibility that it can still be transferred through blood, but just that the risk is much lower if you're undetectable compared to when you're not undetectable, when your viral load is high. Because when you are undetectable, your viral the copies of HIV RNA is below 50, is below 50 to 20 per millimeter of blood. So for you to be HIV undetectable, your HIV RNA should be less than 50 to 20 copies per millimeter of blood. For you to be like that, some laboratory tests shows when you go to some tests, they will even see that you don't even have HIV, but it's still there. When you go for some viral loads, the viral load might not even detect it. So you just protect yourself and take your drugs. So I need to end this live now. Thank you for joining my life. Bye. Bye.